be finishing up the introduction of the skeletal system today, and we're going to start by looking at the classification of bones. So an adult human skeleton has 206 bones, and we will wind up learning most of them. There are two basic types of bone tissue. There's going to be compact bone and spongy bone. Compact bone is going to have cells that are very tightly packed together. It's going to be more dense than spongy bone. You can see it's on the outer edge on each side of this example here. Bones from your skull would have this compact bone on the outside, and then spongy bone in the middle. Spongy bone is called spongy bone because it looks like what we would use to wash dishes with, that kind of sponge. So there are little thin pieces of bone in there as well as lots of open space. Okay. There are different types of bone shapes, and we'll look at those next. There's one that's not listed here, and we'll talk about that even though it's not part of this diagram or on this list. But we'll start with what's here. So long bones their name comes from the fact that they are longer than they are wide. They are mostly made up of compact bone. You will have some spongy bone at the ends of your long bones, but mostly they're compact bone. And it's going to be the bones of your limbs that are categorized as long bones, except for your kneecap, wrist bones, and ankle bones. Next, we have short bones, and they kind of have a cubical shape to them. They're going to be mostly spongy bone, and we have those in our wrists with our carpals and our ankles or our tarsals. Flat bones are surprisingly flat. They are pretty thin and usually have a curved structure to them. They're going to be two thin layers of compact bone with spongy bones sandwiched in between. So what we just saw on that previous slide here, this would be a flat bone. The bones of your skull, your ribs, and your sternum would all be considered flat bones. And then the last one we have listed here would be irregular bones because they don't really fit into any of the other categories. They have odd shapes, and that's going to include your vertebrae. And now the one that is not listed here would be a sesamoid bone, and that's going to be an example of that would be like your kneecap, okay, your patella. Sesamoid bones are embedded either in a tendon or a muscle. So your patella in that example is suspended in the patellar tendon. So next we have the gross anatomy or large scale anatomy of long bones. The features that we see in long bones we'll see in some capacity in other bones, but this kind of fits everything that we would see in any kind of bone. So first we'll start with a diaphysis, which is unique to a long bone. It's going to be this long shaft in the middle of the bone. It gives the bone its length. And it's mostly compact bone there. Next we have the periosteum, which is this white kind of fibrous covering. It's a protective covering of the diaphysis of a long bone. And you can kind of see them in this part of the diagram, which are Sharpie's fibers or perforating fibers, and they just help hold the periosteum onto the actual bone underneath. The ends of the long bone are called epiphyses, or an epiphysis would be singular, and they're going to be a thin layer of compact bone, which you can kind of, if you look closely, the blue on the outside here is cartilage, but right below that you see this kind of solid part of the bone there. That would be compact bone, and then in the center here we have spongy bone. Like I just mentioned, this blue that we have here, also here, is the articular cartilage, and that's going to cover the ends of the long bone. It gives a reduction in friction at the joint surfaces, so it allows for easier movements, more smooth movements. When people do need joint replacements, like a hip replacement or a knee replacement, usually it's because that cartilage has worn away and they have bone rubbing on bone, which is very painful. Next we have the epiphyseal line, but I'm going to jump ahead to the epiphyseal plate first, and then we'll come back to that. The epiphyseal plate is hyaline cartilage when we're younger, and it's going to allow for the lengthwise growth of our long bones at the epiphyseal plate, so it's also called our growth plate. When we are finished growing, then it kind of hardens and it becomes the epiphyseal line, which is just the remnant of our growth plate. Next, we have the medullary cavity. You can see it in here, this bone marrow, the yellow bone marrow that was in there. It was hollowed out in this part, so you could see the medullary cavity. Yellow bone marrow is fat or adipose tissue, so it's kind of energy storage. And then we have red marrow, and that is going to be where our blood cells form. They are found usually in the medullary cavity in infants, and then as we age, that goes away. That becomes yellow marrow that's stored in there. And then the red marrow is just going to be in the ends of our long bones and kind of where that spongy bone would be, as well as in our flat bones as adults. Next, if we look at microscopic anatomy of compact bone, up here you have what compact bone would actually look like under a microscope. And then here we just have a drawing of that compact bone. So there's lots of passageways through here because you do have nerves and blood vessels running through that compact bone. And there's going to be a structure. Let me find it on here. Here we go, the lacuna. So that's going to be like a tiny little cavity where we would find our mature bone cells or our osteocytes. So remember that as osteoblasts lay down new layers of cells, they get trapped underneath and then they mature or differentiate into osteocytes. The lacunae, which is just plural for lacuna, which is what we see in the diagram here, just so you know the differences between those words, singular versus plural. That's all that difference would be. Those are arranged in concentric circles, which we call lamellae, around canals that we call haversian canals. So you can see that the canal right in here, okay, the central canal or the haversian canal. And those canals are used for blood vessels or nerves to run through. So wherever you see a lengthwise blood vessel passing through, it will be passing through that central canal. Let's see. Okay, so next we have osteons. Okay, an osteon, which we can have, you have it like bracketed out here, or this whole structure in the microscope image would be an osteon. Or another name for them is haversian systems. Okay, so those rings that we just talked about, those concentric rings that we call lamellae, will form that osteon. There's tiny canals that are called canaliculi that will radiate outwards. Let's see, let me find that on here to show you. So the canaliculus right in here, okay, that radiate kind of in the opposite direction. They are just going to help connect those structures that we've just been talking about. And then perforating, or also called Volkmann's canals, will run kind of perpendicular to the shaft of the long bone, and that just allows for communication, so nerve communication, blood communication among those different layers of bone. Next we have just looking at the bones on a much larger scale as an actual organ, so each bone would be considered an organ. And your bones are classified into either the axial skeleton or the appendicular skeleton, based on what part of your body they make up. So in this diagram here, the blue is going to be your axial skeleton, that central part of your body. And then the pink would be your appendicular skeleton. So the axial skeleton forms that longitudinal axis of the body, skull, vertebrae, rib cage. And then your appendicular skeleton is everything else. It's your arms and legs, as well as your pectoral and pelvic girdles, or your shoulders and your hips. So the bones of the axial skeleton that I just mentioned for you are the skull, vertebral column, and thoracic cage or rib cage, which also includes the sternum. If we look at bones of the skull, so we have the cranium as well as your facial bones. So the cranium is what actually encloses the brain. You've got the frontal bone, parietal bones, occipital bones, which we've mentioned a little bit before when we talked about the brain and said that the names come from the bones around those lobes of the brain. Your facial bones are going to hold your eyes in place. They allow your facial muscles to kind of express your feelings through smiles or frowns or rolling your eyes, different things like that. If we look next at your vertebrae, you have 7 cervical vertebrae in your neck. They are going to be called C1 through C7. The C tells you that they're cervical, and then 1 through 7, that number tells you if it's the first, second, third, all the way through the 7th cervical vertebrae. So that's where that kind of name comes from for them. The C1 and C2 vertebrae have a special name. They're going to be the atlas and the axis. So C1 is the atlas and C2 is the axis. We talk about joints in a little bit, that we'll mention them again. Then you have 12 thoracic vertebrae that connect to your ribs. So your ribs, your 12 pairs of ribs come out on either side of the thoracic vertebrae. So they would be named T1 through T12. And then you have 5 lumbar vertebrae and your lower back. And they are going to be L1 through L5 since you have 5 of those. Then we have your sacrum and your coccyx. The coccyx in people is what we call our tailbone. The normal spine has an S shape from front to back. So if you're looking right at someone's back and you're looking right at their vertebrae, it should be straight up and down. If you were looking at someone's spine from the side, it should have this slight S curve to it. There are some issues while we're talking about the spine that we're going to talk about. So one would be with a herniated disc or a slipped disc. And so in between, you can't really see them from this diagram too much, but these little like thin lines that you see in between here, those would be discs. So those discs are like little cushions, like little shock absorbers. We call them intervertebral discs. They are kind of flexible. They're made of fibrocartilage. And again, you have them in between each vertebrae in your spine. They're going to allow you again to absorb shock. So let's say that you fell and you landed on your butt. You're going to have that shock absorption to help keep your vertebrae protected, and then in turn keep your spinal cord protected. They also provide some flexibility to the spine. So what happens when somebody has a herniated disc or a slipped disc is that disc moves out of place. So that can then put pressure on possibly a spinal nerve that's coming out from in between the vertebrae or on the spinal cord itself. So the discs themselves have a lot of water in them, and as we age, that kind of goes away. So as we age, those intervertebral discs become harder, they're less compressible, so it's easier for this issue to happen as we age. Exceptional twisting forces. So if you were to, I don't know, I'm trying to think of an injury that like something would happen to you. But if you were to be turned, or like an arm was to be pulled maybe, and you twisted too far, that could also cause a disc to slip. But symptoms of a slipped disc or a herniated disc would be that pressure that I mentioned before on either the spinal cord or spinal nerves. And that's going to cause anything from numbness to excruciating pain for that person. Sometimes people have to have surgery to fix that because it is so painful, to allow them to get some of their mobility back and reduce their pain. And then the other thing we have here with your vertebrae or your spinal column are abnormal curvatures of the spine. So again, from front to back, if you're looking at somebody's back, your spine should be straight up and down. If you're looking at somebody's spine from the side, it should have this slight S curve to it. Okay. One thing that can happen is something called scoliosis, and you see that here, where there's an abnormal right to left curve or left to right curve, depending on where it happens, like what direction it happens. So instead of the spine being straight up and down, it's curved from side to side if you're looking at them from the back. Next, we have kyphosis, which is right here. It's an abnormal curve, so you should have somewhat of a curve here, but an abnormal curve, like this degree of curvature, would probably give somebody a humpback appearance. So that abnormal front to back curve is called, in the upper back, is called kyphosis. In the lower back, that abnormal front to back curve is called lordosis. So kyphosis is upper spine or upper back, lordosis is lower back. One way you can keep them apart is they're alphabetical, okay, from top to bottom, or you can think of lordosis starts with an L, and that's in the lower back. If we continue on with bones of the axial skeleton, look at the thoracic cage. You have your sternum, commonly referred to as the breastbone. It is a flat bone, and there's 3 parts to it. Up here we have the manubrium, the body, and then down here we have the xiphoid process. If you've ever learned to give CPR before, the xiphoid process is talked about because you want to make sure you're giving chest compressions above that on the body of the sternum, because you can actually break the xiphoid process if you're giving compressions too low on the sternum, and that can actually puncture a lung. The sternum is also connected, and you can kind of see like these indents here where the ribs would connect. So the first 7 pairs of ribs are going to attach to the body of the sternum. And then the sternum also covers the heart, so it provides that protection for the heart, which would be right below your sternum. And then we have the ribs, the rest of the thoracic cage. You have 12 pairs, so 24 ribs altogether. And they are going to come out from the back. They're going to be attached to the thoracic vertebrae in the back, and then they're going to curve around kind of downward in the back and then curve back up in the front. The first 7 pairs, the ones that connect right to the sternum, through what we have here, there would be, it's hard to see in this diagram, but there's cartilage called costal cartilage. And those true ribs will come back around from the back, connect from the thoracic vertebrae, and curve around and upward and connect right to the sternum. So because they connect right to the sternum with costal cartilage, we call those true ribs. And that's the first 7 pairs on each side. And then, so the next pairs 8 through 12 are considered false ribs because they don't connect to the sternum at all. Pairs 8 through 10 will connect to the rib above it with cartilage, so they kind of connect upward this way and don't connect right to the sternum itself. And then we have pairs 11 and 12, which still fit in that category of false ribs. These are called floating ribs because they don't attach to the sternum in any way. They also don't connect to any other rib. Now, if we look at bones of your appendicular skeleton, that's essentially everything else for the most part. So we have your shoulder girdle or your pectoral girdle, the upper limbs or your arms, the pelvic girdle or your hip girdle, and then your lower limbs or your legs. So if we start with your shoulder girdle, again, another name for that is pectoral girdle. This is going to include your clavicle, your scapula. So the clavicle, again, common name is the collarbone. It attaches to both the sternum, right here, the sternoclavicular joint, and then it also will attach over here to the scapula. It's going to help to form your shoulder joint, and it kind of helps to hold the arm away from the top of the thorax or top of the rib cage, and helps to prevent your shoulder from becoming dislocated. Now the scapulae or scapula, your shoulder blades, again, they're going to attach to the clavicle, and they themselves are not actually connected directly to the axial skeleton. It's only held in place by muscles. So the only point of actual attachment between your shoulder girdle, so your scapula and clavicle, and the axial skeleton is at that sternoclavicular joint right here. Okay. Other than that, there's no bone-to-bone connection of your axial and appendicular skeleton at any other location, like bone-to-bone. Now looking at your upper limb, we have your arm. Your arm is going to really just be, it's kind of weird because we always think your arm is your whole upper extremity. You have your arm, your forearm, and then your hand. So your arm is the humerus, technically, and that's a long bone. Your forearm is made up of 2 bones, the radius and the ulna. Those are also long bones. To tell them apart, the radius is the thumb side and the ulna is on the pinky side. And then with your hand, you have your carpals or your wrist bones. There are 8 of them. Your metacarpals are in the palm of your hands. You have 5 of those. And then in your phalanges, which would be your fingers and your thumb, you have 3 phalanges in each finger and then 2 phalanges in your thumb. And the way that they're named are proximal phalange, middle phalange, and distal phalange. Proximal would be the closest to your palm, and then distal would be like the part where your fingernails would be. Next, if we look at the pelvic girdle or your hip girdle, you have 2 coxal bones or hip bones, and each hip bone is actually a fusion of 3 bones. So we have the ilium, which is this flared out part here, and that is I-L-I-U-M. It's a capital I there, just to make you aware, because some people sometimes think it's 2 L's, but it's capital I in that right here. Excuse me. The ischium is this part down here where it kind of curves down, and then in the middle would be the pubis, or where they join on the front would be the pubic symphysis. We also have the sacrum. Okay, that's going to attach to the skeleton or the axial skeleton. So the lumbar vertebrae would be here. So technically, even though this is part of your spine, it still is considered part of the pelvic girdle. And there's differences in the pelvis between males and females, so we'll talk about them now really quick. The pelvic inlet is larger and more circular, so this right in here, okay, see pelvic inlet. The bones of a female's pelvis are going to be lighter and thinner. The ilia will flare more to the side, so the hips will technically be wider. The sacrum would be shorter and less curved. The pelvic outlet would be larger, and the angle of the pubic arch is greater. Right here would be the pubic arch. And all of those differences are due to females giving birth, because the baby would need to pass through that opening. And then we have the bones of your lower limb. So we have your thigh, which would be your femur. It is also a long bone, just like we talked about with the bones in your upper limb. And it's actually the heaviest, the strongest bone in your body would be your femur. In your leg, we have the tibia and fibula, as well as the patella. The tibia is the larger of the 2 lower leg bones. It's on the big toe side or the medial side of the leg. And then your fibula is the thinner, smaller lateral bone of your lower leg, or of your leg. And then we have the patella or your kneecap. Again, that's a sesamoid bone, so here you have it in writing to refer back to from when we mentioned it earlier. And that's held in place by the patellar tendon, actually. So that's wrong. And then we have your foot. You have your tarsals. You have 7 tarsal bones or 7 ankle bones. Your metatarsals, which will form the sole of your foot, and then phalanges. So just like with your fingers, you have 14 phalanges per foot, just like you have 14 phalanges per hand. They are also named the same way, proximal, middle, and distal. And then your big toe, just like your thumb, only has 2. It only has the proximal and distal. Next we have your joints. Another name for them would be articulations, and they're really just points where 2 or more bones meet. All of your bones in your body form joints except for the hyoid bone, and the hyoid bone is in your neck. Your joints have pretty much 2 functions. They hold bones together securely, as well as give our skeleton mobility. The skeleton itself doesn't move unless there are muscles attached to it pulling on those bones. But without the joints there, the muscles could pull on the bones all they wanted, and there would be no movement. There's 3 kinds of joints that we'll talk about. So we have fibrous joints, cartilaginous joints, and synovial joints. Fibrous joints are going to be found in the suture joints of our skull. Okay, so kind of all these lines that you would see on a diagram of a skull, those are fibrous joints. They're united by fibrous tissue. Another place we have that would be something called a syndesmosis, where we have the distal ends or the ends closer to your ankle that hold the tibia and fibula together. Cartilaginous joints are going to be connected by cartilage or fibrocartilage. We have that at our pubic symphysis, where the two hip bones are connected in the front of the pelvis, and the intervertebral joints of the spinal column. So where those intervertebral discs would be, they are going to create those intervertebral joints. And then we have synovial joints. These are going to be the joints you would typically think of as your joints. The ends of the bone are separated by a cavity containing a fluid that we call synovial fluid, so that's where their name comes from. All of the joints in your limbs are synovial joints. There are 4 distinguishing features to your synovial joints, and they're going to have articular cartilage, an articular capsule, a joint cavity, as well as reinforcing ligaments. Other features they have are bursa and a tendon sheath, so we'll get to talking about those. The types of synovial joints, and you can see diagrams of them here and where they would be located. You have a plane joint, where the two surfaces where the bones meet is going to be essentially flat, and they're just kind of short, slipping, gliding motions. An example for that would be the joints in between the carpals in our wrist. A hinge joint, if you think of like the hinge on a door that allows the door to open and close, you have a cylindrical end of a bone fitting into a trough-shaped surface on the other bone that it forms the joint with. And that movement, just like a door, is allowed in one plane. So we would see that in our elbows and our ankles, as well as the joints between our phalanges. So like if you bend and straighten your fingers or your toes. Next we have the pivot joint, and here's the one I told you when we talked about the atlas and the axis we would talk about later. A pivot joint, you're going to have a rounded end of a bone fitting kind of into a ring of bone from the neighboring bone. So we have those at the radio-ulnar joint, and we have them, and here we have them, that's what I was talking about before, in between the atlas and the axis, or the C1 and C2 vertebrae. So if you pivot or like turn your head all the ways you can move your head, that's because of that pivot joint in between those first two vertebrae. A condylar joint is going to be your knuckles. So you have like kind of an egg-shaped or protruding surface that fits into a concave surface of the neighboring bone that it joins with. And it's going to allow a movement from side to side and back and forth. Next, we have a saddle joint, which we find at the base of our thumb. So that gives our thumbs its unique ability to like let us grip things. So each bone that forms those joints there have both convex and concave areas like a saddle would fit onto a horse. And then we have a ball and socket joint. We see those in our shoulders and our hips. So you would have a spherical head, which would look like a ball, fitting into a round, like concave part of another bone, or fitting into the socket of another bone. There are some issues that can happen with your joints. One of them is bursitis. We mentioned before that your synovial joints have something called a bursa. And so bursitis can be caused by an infection, but it can be caused by other things as well. But it's inflammation of the bursa in the joint. It's very painful. You can get it from overuse of the joint, so repetitive movements. It can be from an injury or from an infection. A sprain is going to be damages to the ligaments or tendons that help to reinforce the joint. They're very slow to heal, and they're very, very painful. And then lastly, we have arthritis, which is going to be inflammation of the joints. There's different types of arthritis that you can see here, and we'll talk about each of those. But there's usually pain and stiffness and swelling of the joints associated with arthritis. So first we have osteoarthritis, or OA. That's the most common form of arthritis. It's a degenerative condition, so it gets worse over time. It can come from overusing the joints. And again, it's going to affect that articular cartilage. That articular cartilage would kind of wear away, or become inflamed and painful. Next, you see rheumatoid arthritis, or that's also called RA. This is actually an autoimmune disease where your immune system would destroy the person's articular cartilage. And then lastly, we have gouty arthritis, or it's also commonly just called gout, where there's uric acid in the blood, and that kind of accumulates and deposits in the joints. So kind of like these little crystals would be deposited there. Usually it only affects a single joint, like usually a thumb or like the base of your big toe, for example. But again, that is going to be painful. There's medication that people would take. Usually once you have gout, you need to be on medication to kind of prevent that. At least if you might have it once and they might kind of wait to see, but if you get it again, typically they put you on medication to help prevent that uric acid from building up and causing that problem.